All right, so I got my windows lined up. I'm going to start this second. Here we are. Hit this, and then hit this, and we're here. We're live. Hello, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachola with PAR5 Physical Therapy here in Randolph, New Jersey, and I partnered with them to give you an easy and educational workday session for your Tuesday afternoon. So today's session is low back pain, super common issue, low back pain from root causes to real solutions. You're going to learn into the most, we're going to dive into the most common orthopedic complaint and explain how posture, prolonged sitting and static positions and decreased activity, especially in the cooler months, increase your risk for having back pain. We'll cover the role of the hip, the thoracic spine mobility, and core control, and even lifestyle factors, and learn 3 practical home exercises that you can do to prevent low back pain. All right, so everybody's in here. Just a little bit about me. I got my doctorate in physical therapy. I think that is like 2010, 2010, from Mercy University in Dobbs Ferry, New York. I also have a bachelor's, a BS in exercise physiology from Rutgers University, graduated in 1994. And I'm an orthopedic specialist, board certified orthopedic specialist, certified dry needling specialist, certified golf medical professional, and certified golf fitness coach, and also a level 1 CrossFit coach. So that's me. And for the past, I don't know, maybe close to 30 years, I've been helping active adults get back to doing the things that they love to do without pain meds, injections, or surgery, especially even if they've had physical therapy before, because not all physical therapy is created equal. And the way that I do it, I always have this satisfaction guarantee to get people back doing what they want to do. All right, but anyway, enough about me. Let's get started, because we got a lot of things to cover. All right, got a little hiccup there. My CPU is getting overloaded, I think, right? Yeah, so hopefully you guys can hear me. And now I just slowing down a little bit. Yeah, so this is technology. Again, if you can hear me okay, just give me a thumbs up, but we're going to dive into it. Low back pain from root causes to real solutions. Let's hit this button and see if we move forward with my slides. All right, there it is. So hopefully everything catches up and sinks in. The video can sync with the audio. But anyway, if you've been to any of my classes before as a medical professional, I have to put up this slide that if you're dealing with something specific, make sure that you have it thoroughly assessed, get a thorough physical exam to find out the root cause. Because the stuff that we're going to be talking about is aimed at a broad and general population. It is helpful and useful in the past 25 to 30 years. I've been using these techniques to help a lot of people. But if you're dealing with something specific, make sure that you have that treated. All right. So, we got fancy with that transition. So anyway, this will make sense later, but the source of your back pain isn't always the cause. One of the sayings that I always tell my clients is that, victims will scream, but criminals stay silent. So victims will scream and criminals stay silent. So that means that even though your back hurts, that's where the pain is, that's the victim, but the criminal is somewhere else. All right. So we got to dive into that. What causes the pain? So what is the spine? So really quick, we're going to go through this anatomy course here. Your spine is a resilient structure. It's made up of vertebrae, the bones and then joints. There are facet joints. And then you have the disc, which is like analogy that we use frequently in PT, is a jelly donut. It has this hard outer shell and then a soft inner covering to absorb shock and allow for movement. And then we have the nerves that come out of the spaces in between the vertebrae. And then everything's connected with muscles, fascia, and ligaments, tendons. And then we have your core. So the core is important, and we're going to talk more about what that is later. So just a quick little look at this. This spine is made up of 3 parts here. You've got your cervical, you've got your thoracic, and you got your lumbar. They have these curves, right? So the curves of your spine distribute force and absorb shock easily, or in this, you know, it's a stronger structure than something that's straight. And with postural positions that we put ourselves in, oftentimes what we see is a reversal or reduction of these curves, which causes a lot of the issues with back pain. Wow. You got some slow internet today, I think. Well, at least you can see the slides. I think that, you know, this is live, folks, and what we're doing here, this might be a sign to update my internet or my laptop. All right, so anyway, if you've been to my classes before, you've seen this video. This video basically explains that the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So if you're looking at this and we break it down, particularly for the lower back, if the lower back hurts, it's usually because it's lost its ability to do what it's supposed to do, which is, you know, be a stable segment, the lumbar spine, right? And if we look at the segments above and below that, we have the hips below it and the thoracic spine, the T-spine above it. So oftentimes, if people have a tight or limited mobility in their hip or their thoracic spine, then what happens is that this alternating pattern is disrupted. So then our body unlocks or makes your lower back unstable, makes it a mobile segment. Or it could be the the knee downstream from your hip. But if your hip is not mobile, then your knee becomes mobile. So your body tries to get back what it loses at one segment from another segment. All right, so that's it. Anything that we're looking at here, and if you're concerned about your lower back, you got to look at the hip and look at your thoracic spine, because the immobility in those two spots can create instability in your lower back. All right. So 3 common causes of back pain. We have muscle spasms. You know, a muscle in your lower back can be tight. It could be weak. You know, how do we find out? We find that out with a physical exam. You know, it could be a muscle imbalance. You know, if you stretch and a muscle isn't tight or it's long enough, it's not short, then stretching is not going to help. Or some type of all this other soft tissue work. I mean, is it truly a tight muscle, or is it weak? When a muscle is weak, sometimes it kind of does the loads that you put on the muscle exceed its tolerance, and then it just shuts down. It's really, really contracted and short, and it doesn't want to release. Another one is joint dysfunction. Joint dysfunction is basically these facet joints in the spine. They're like shingles on a roof. When you extend or go backwards, the shingles close, they slide on one another, and then when you bend forward, they slide open, they slide upward. So any joint inflammation like arthritis or degenerative changes, that affects how these joints slide and move, and they can get stuck, they can get rough, but that happens. That's very, very common as we age, because we live on Earth, there's a lot of gravity here, puts pressure on our spine, whatever, and then over time, then we have these joint dysfunctions, which is very normal. It's part of the aging process. But does that mean that because you have some joint degeneration, does that always mean that you have pain? No. All right. Everybody over the age of 40 probably has some type of positive finding on an MRI or X-ray, but that does not necessarily mean that that is the cause of the pain. All right. Then you have your disc. The disc pathology, the disc is like a gimbal, right? It's hard outer covering, a soft inner, and that soft inner, you know, there's bulges, herniations, impingements as it kind of protrudes into the joint space, and all of that can also result in nerve symptoms, right? But typically, herniations and disc bulges, they heal on their own, right? It just takes time. But that pain can be very excruciating as it irritates the nerve. There's a lot of things that we can do to improve joint, soft tissue mobility and nerve mobility, so that you have less symptoms going down into the leg, less radiculopathy, we call it, and it can improve your range of motion and strength. So pain is very complex. It is a connection of, you know, your physical, neurological, psychological, and social. Pain can occur in the complete absence of any tissue trauma or damage. The brain is the key, your central nervous system, because essentially pain is a signal. It's an output from your brain. The electrical signal goes to your brain, and your brain has to interpret it and then send out a signal that says, hey, what is this? It's a, is it sharp, stabby, dull? Is it something that I need to pay attention to? There is a sensitivity dial in your brain that kind of dictates whether or not a stimulus is a threat, i.e. pain. So, if you think about being in a dark alley, the analogy I use is like if you're in a dark alley in an urban environment, you have a lot of money on your hands and people can see it, but you can't see them, you're under a lot of threat, the sensation of anxiety and worry, and your level of threat is high, versus if you take yourself and put yourself on a beach and you're lounging in the beach, you just hear the waves and the seagulls and your hands touching the sand, you're going to be under less stress, less threat, less apprehension. So that's the way that your nervous system, your brain goes through. Is it under a lot of threat or not a lot of threat? Is it something that I need to pay attention to or not? Is it a fight or flight situation or a rest and digest situation? So the nerves and your central nervous system really need to be addressed especially when it comes to chronic pain, because chronic pain that kind of lasts for more than 6 months, that's considered chronic. We need to address your nervous system, not just the musculoskeletal issues and other stuff like that. So if we only treat the pain where it hurts, we only get this temporary relief, because typically we just look at the results. We just chase the pain. We're not treating the root cause. So stuff like massage, chiropractic care, physical therapy, or even surgery, no one treatment is the answer. Medical knowledge changes every 5 to 7 years. New research comes out, and that changes what we know about what causes back pain and what are effective treatment strategies. So the research, though, that has been shown that passive modalities are less effective than active modalities, meaning that if you've ever been to a medical professional to treat on your back and you are lying on the table and they put ice, stim, or heat or something massage, that you are not doing anything, you're just having stuff done to you. That's a passive modality. That is less effective than active modalities. We need a combination of addressing the neural causes of pain, that central nervous system issue, and the mechanical causes of pain, because pain is a very fluid experience, right? We mentioned that it's influenced by many factors: stress, hydration, fatigue, environment, your beliefs, your emotional state. Mood is big connection to pain. Pain will put you in a bad mood, but if you're in a bad mood, also you'll feel more pain. So it kind of goes hand in hand. So we have to kind of address everything. So it's a combination of a lot of things. But my philosophy is always this, is that it's your body. You need to maintain it. Everyone should be able to maintain it so that your body can function for years to come. There's a great episode of 60 Minutes. I don't know if you've seen it, with Dr. Peter Attia, talking about how for the last decade of and health in that last decade of medicine versus a reactive approach to medicine. All right. I just got a message that my internet connection is unstable. So we'll try and make this quick. And that's probably why my whole thing is kind of going choppy right now. Anyway, directional preference is basically when we do have back pain, typically we'll have a flexion moment where we bend and an extension moment where we extend these directions, forward or backward bending. One of them feels worse. Typically, the opposite will feel better. So you can always try this with your spine, bending forward, going backwards. What feels worse, what feels better, and then whatever feels better, that's a direction that you want to work into. All right, so let's pull up my self-trigger point release. This is one of the things that we're going to go into our exercise. Hopefully, I can do this. All right, here we go. So this, I don't know on your end if things have changed for you, but my camera is not stuttering anymore. So give me a thumbs up if you've seen a difference. I switched to this camera and there's less stuttering versus when I was on my laptop camera, there was a lot of stuttering. So give me a thumbs up. Are you guys with me? I see it. Yep. Okay. So it's not just me. It's the hardware. All right, so now I'm going to go to Best Buy later on and see if I can get a new laptop. Anyway, so soft tissue release. If we have these muscles that go up the spine here and we've got like a tight muscle or something like that, we need to do something to relieve that tension. And if we think about how the muscles and fibers and all those tissues, they're kind of stacked on one another and they go side to side, they lengthen, they stretch and they contract, they shorten. We want to have everything moving well. So let me grab something back here. Super easy. You've got a couple options you can do with a lacrosse ball. So this is kind of like a trigger point release ball. It's like hard. Or you can get fancy and get one of these other things. And let me see if this thing has battery. It's been sitting on the shelf for a while. But basically, this is a massage ball. It vibrates. I don't know if you can see that on camera or hear that on the microphone, but it vibrates. And any type of vibration or type of tactile input that you can put into your tissue, especially in an area where it hurts, that can reduce that level of threat. All right. So if we take one of these things, you could do this in two different ways. You could see my chair. I'm in the frame. You could take your ball and put it on your lower back. And this is great. Like if you're traveling and you're on a plane and you want to loosen up your back or you're tight, take a ball with you. It's easy to kind of carry on. And you sit back, get your hips all the way back into the seat, and you find a spot above your pelvis to the side of your spine and below your ribs. And then you can kind of, apply pressure and work onto that. Now, in sitting, and you're doing this vertically, in this vertical orientation, there's a lot less pressure on your back. So a lot of people can tolerate this a lot easier than the more advanced version, which is taking your implement and lying down on it. So here's the spot that we're going to do. Hopefully I can get this on camera. So above the pelvis, to the side of your spine, and below the ribs. If you put it on the bone, you'll know it's hard and it's going to feel uncomfortable. If you put it on a trigger point that feels like it's soft, it's firm, and it's uncomfortable, that's a signal that your body needs to relax and work that muscle out. So the first thing that we'll do is we're going to lie down. This is going to be a lot more pressure. Find our landmark, right, and get it in that spot. And the first thing is just to breathe, because once we start to find a trigger point and that sensation, that tactile pressure starts to go into our nervous system, we go into this fight or flight response. And we want to calm that down. And the way to calm that down, the quickest way, is to just breathe through your belly. So think about, putting your hands on the side of your ribs or lower ribs here on your belly and try and breathe into your hands. And everything is nasal breathing, in and out through the nose, not through the mouth. How you breathe properly. And then taking those slow, deep breaths and long exhales, that's going to relax the muscle and relax your nervous system so that you can get into that tissue to knead and move that around. If you need more pressure, the next progression, intensity, is going to be bringing your knee into your chest and then pushing and pulling your knee in and pushing a little bit more weight onto that trigger point. So working through that muscle over about 1.5 to 2 minutes at least is going to help relax that muscle. But again, the first thing you have to get by is that fight or flight response. Okay, so in my slides, the next one is going to be a mid-range stretch, your cat camel, right? So we borrow a lot of movement practice from yoga. If we look at this position here, it's supported, hands below shoulder, knee below hips. We go through a range of motion that's comfortable in the spine, sagging the belly down into the ground and then bringing your back and rounding it up to the ceiling. So from this side view, you can see how my back extends, sagging. I'm going backwards, right? We're closing the vertebrae and the joints of the spine, the facet joints. And then when I round out, hopefully you can see that, it rounds out. I flex, I'm going into flexion in my spine, and that opens up the vertebrae, stretches out the soft tissue. So this position here, again, you go through a range of motion that's comfortable. Don't push into extreme ranges if it starts to hurt, because again, you're going to feed back into that fight or flight response. We want to just go easy into it, breathe through it, go slow, mid ranges, and start to increase the size of that motion as you feel comfortable. The bigger the move, the better it is. You could also do this in sitting, just like what we did with the ball. We're going to sit down And I'm going to show you the side view here, hopefully. Yeah, there you go. You're going to be sitting in your chair, and then we could do the same thing. I'm going to brace my upper body with my hands on my knees, keeping my elbows straight. And I'm just going to slouch, and you'll notice how my pelvis rocks or rotates backwards, and then extend or over exaggerate this extended position so my pelvis rolls forward. So we get this backward rotation and forward rotation. That's taking our spine into flexion and extension. Okay, close-up view. If I go here, right, here's my spine. It's basically flexion, pelvis rocks underneath you, my tailbone tucks, and then extension, my tailbone goes out, my pelvis rotates forward, and then I arch my back. So this is extension, this is flexion. When we mentioned that directional preference could be here, sitting, flexing the spine, all right, or sitting. How does that feel if I repeatedly do this? If that feels good, then I keep doing it. If it feels like it's painful, then we go in the opposite direction. The opposite direction is just extension. So we just continue to do extension. If this feels good, we keep doing it. So everybody, typically, if it is a mechanical issue in your spine, like musculoskeletal, it's not like a chemical thing or some type of other tumor or whatever, we can figure out that directional preference. And in standing, you could do it as well. I've had people kind of go into the slouch position and kind of just round out, and that creates a lot more stretch into the hamstrings. Or you can go in extension. I go wide with the feet. Feet are wider than my hips, and I put my hands on my hips, fingertips down on my butt, and then I push my hips forward. Now I'm going into extension. So these are two different directions that typically can help reduce sensitivity and restore normal range of motion. So you go into the direction that feels good, and you try and limit the amount of times that you're going into the painful direction. All right, so let's check what is else going on. So, oh yeah, so the next one is this half kneeling hip flexor stretch. So really quick, look at that. I'm going back to this camera and we're going slow. It's crazy, right? All right, so let's go back to the old one, half kneeling hip flexor stretch. So this is important because when we sit, our bodies adapt to the positions we put it in. All right, so here I'm sitting, my hip is flexed and my spine is rounded. So what happens, and I see this a lot with people who sit for a lot of times during the day, is that all of the soft tissue structures like the hip flexor muscles, they start to get short in the front part of your hip. And then it's fine right now, but then when you go to stand up or walk, what tends to happen is that you go to stand up, and because we're tight in these muscles here in the front part of your hip, as we go to stand, we run out of room. I can't extend the hip. My hip turns into, instead of a mobile segment, into a stable segment. It gets tight, and then my back has to unlock. And then this is how we go around being straight. And because my hip is always flexed as I'm walking around like that, my back muscles have to work overtime to keep me straight. Whereas it's easier if I can open up the hip, activate the glute, get my pelvis and shoulder in line. That way my spine muscles don't have to work as hard. So the hip flexor stretch, you could put a pillow underneath your knee or a cushion. You're basically going to work on stretching the knee or stretching the thigh that's down. So if I'm here, I have this knee directly below my hip, and this foot is directly behind the knee. I want to be able to get this stretch into this region, this front part of my hip. So the way to do that, just like with any muscle, if I pull one end of the muscle and I don't stabilize the other, what's going to happen is that everything just kind of moves and we search for the stretch. So with any stretch, we want to stabilize one point, and we stabilize the other and separate the two. That's the most effective way to stretch any muscle. So the muscle that we're going to work on starts on your lower back, dives through the abdominal cavity, and inserts into the front part of your hip. So the first thing I want you to do is see, can you contract or squeeze your butt muscle, this glute? So if we squeeze your glute, that contracts the pelvis, keeps my pelvis in neutral, and then from here, if I can pull my ribs down, activate my abdominals, that should give me the stretch in the front part of the hip. The more often I do this, and then if I progress my hip forward, if I move forward, it gets more intense. I do not want to unlock all of that because I can just kind of go and search for the stretch by letting my back arch. And then I feel it. Like, yeah, I'll feel it. But if I stabilize both ends of the muscle, get tight, and I just I can get it right there. So I'm more specific, and it's more effective when we stabilize both points of the muscle. Static stretches like this, you want to hold for 30 seconds. 30 seconds multiple times a day. This is going to unlock the hips when they get too tight from this position. All right. All right. So it is almost 1:30. We did this thing, and then we did that thing. All right. So one of the other things that happens, oh boy, I'm going to transition to this. Here we go again. See if I could readjust everything. No, it's still going slow. But anyway, transverse abdominis, right? I just need to show this real quick. Let's try this. And there we go. All right, control your core. These are the four muscles or four layers of abdominal muscles that are important. You have your rectus abdominis, which is the most superficial one that goes straight up and down. Here's my mouse. There you can see. And then you have the internal and external obliques that go diagonally. But the one that's most important is this transverse abdominis. That's the deepest one. It wraps around like a girdle. If you've seen people with like back braces or belts or stuff like that, it wraps around like this. That muscle, transverse abdominis, is your natural back brace. So a lot of times people with chronic back issues have a problem contracting this muscle. So real quick, I'm gonna lie down. I'm gonna show you how you can check this on your own. All right. See if you can control. All right. So you got me on the camera. Cool. All right. So you're gonna lie down. Knees are gonna be bent. What I want you to find is your pelvic bone. Your pelvic bone is pretty easy to find. It's a little pointy. And if you find that, make that your landmark, and you dive into your belly button about an inch to the middle. If you're relaxed, all of this muscle should be soft. And now what I want you to try and do is pull your belly button into your spine. If you pull your belly button into your spine and you find yourself holding your breath and you don't feel any tension underneath your fingers, then that means that you're using your diaphragm as an artificial stabilizer for your core. All right. So the proper way to do this is when you have that palpation right there off of your pelvic bone and you pull your belly button into your spine, you should feel that muscle tense up underneath your fingers, right? And you should be able to breathe. Okay. So transverse abdominis really creates that abdominal tension to squeeze everything together. It's different than the rectus abdominis or the obliques because they kind of get activated with sit-ups and curls and stuff like that. But the transverse abdominis just kind of squeezes and it compresses. And that's what stabilizes the spine. And if you have that tension in front and you could still breathe, that reduces a lot of the stress onto your lower back with prolonged activity and standing. All right, so let's pull up this thing here. All right, I think that's it. I'm going to say, okay, all right, something happened and we're okay. All right, looks like my hardware, my computer kind of came back to life, and then the CPU is cycling properly, everything's fine. So anyway, that's all I've got for you today. I want to thank you for joining me. I'm going to give you maybe like a 30-second countdown. If you do have any questions, put them in the chat now. I'm going to give you a second and see what's going on up there. All right, good. All right, so nobody's got any questions. It's 1:30. Again, I want to thank all of you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps. Side note, all the exercises that we just did, if you're interested in seeing videos where I talk through them and show you again, you can go to YouTube and search up PAR5 PT. There's a playlist on YouTube that I put up addressing low back pain, and it has the videos of the exercises that we just went through. So you can kind of reference that as well. All right, so I will be back again on Tuesday, November 11th for my next class, which is Hip Hinge Mastery, the key to lifting, playing, and protecting your spine. All right, so you're gonna learn why the hip hinge is one of the most important movement patterns for protecting your back and powering sports like golf and pickleball and all those things like that. So you'll learn to correct techniques for hip hinging and bending and lifting safely. So let's see here. Any questions? Oh yeah, so your Instagram or email, let me see here. Any CPD training? What is CPD training? That is interesting. I do have an Instagram. It is there. So, but anyway, if you have any questions, you could feel free to email me at paul@par5pt.com or team@betterspaces.com. Thank you for coming and be well. All right, let me stop this.